everybody. Today we're at Cinnamon Girl Clinic with Amy and our model Dom, and Amy is just teaching us a little bit about scalp micropigmentation. So we have Dom here today, and he is rocking the shaved head look, so he's a perfect candidate for SMP. And Amy, you're about halfway, a quarter way through the procedure today, so come on over and let's take a look.
So I'm just getting started working on his hairline. We did the back of his head already, and now kind of where it's all red is where we've gone, and now we're just gonna do the hairline and blend it into his existing hair here and make it just look super natural, and yeah, then he won't have to worry about anything.
So we asked earlier for you guys to write in and ask any questions that you had for Amy. So we'll start with one of the most common, that is, does it hurt? And I almost want Dom to answer this right now.
Dom, you can answer this question. Does it hurt?
Honestly, no. It feels good.
So obviously Dom has some tattoos. He's maybe used to it a little bit. He actually chose to opt out of using numbing today. So he doesn't think it hurts. But if you do have maybe a lower threshold, Amy does numbing. So you're not going to feel a thing. So the answer is that no, it does not hurt. Something else that you guys might be wondering, especially because we have a shaved head here, is do you have to shave your head before your appointment? So Amy, what's the answer to that one?
It's all depending on the style you're going for. So if you are someone who is wanting to lower their hairline and has, you know, an inch or two of hair, but you're wanting to lower your hairline, it's probably best if you shave your head. That will make a nice balance between the density. It would look a little silly if you had the impressions of the tattoo and then hair. That difference starts to really point out and make it obvious that it is a tattoo. So shaving your head is best for that. If you're looking for density, where we're working, especially with women or men who have hair loss in the back, and you've got a full head of hair, you're just kind of thin on that part line or in the back, you do not need to shave your head. It will blend in very seamlessly on that part. The most important part is if you're wanting to lower your hairline, you would need to shave so that you can't tell the difference in the texture or the difference in density having longer hair and then little dots.
And so for the ladies out here who might be having thinning and density issues, whether that's a patch, whether it's their part line, they want to look a little bit more full, of course, they're not going to have to shave their head. Do you want to tell us a little bit how it works for women?
Sure. So women and men, the hair loss is very similar in the sense that hair loss is progressive, unfortunately. So we all kind of experience hair loss on a different scale. And what will happen is with a woman, if you're looking to add, usually we want our temporal points filled right in here. When we pull our hair back, we kind of have those like cat ear looks. What we're wanting to do, we can fill that in for sure, but you're wanting to add a Rogaine or another topical solution to your routine, a really good shampoo to keep that existing hair there so that we're not dealing with dots and then hair, which looks really unnatural. But you can still definitely do it on the hairline to strengthen. Also, women who have had a hair transplant to strengthen their hairline or lower their hairline, there's absolutely no problem going in there. No hesitation on my end because that is permanent hair. Same with men. If you've had a hair transplant and you're wanting to add that density in there, no hesitation. I will fully do the hairline because that's your permanent hair. It's not going anywhere.
And so we do have somebody else here with us today that has a different hairline than Dom. So Kevin, Amy, do you want to talk a little bit about what SMP would look like for Kevin, or Kevin, maybe what your goal with SMP might be?
Yeah, let's start with your goals. hair goals, Kevin?
Hair, keep it as long as I can.
Mhm.
So I think that means for me in the coming years, just trying to, if possible, create some density in the front, because that's where I'm really thinning out.
Yeah.
So I'm wondering if SMP would be an option. I do have a lot of gray, and I do have longer hair on top, but I'm just wondering what's available.
Definitely. So you could for sure do SMP on the top of your scalp throughout the back to add that density in there. Because you like to wear it a little bit longer, we'll just be a little bit more selective with our color. You've got a lot of different color tones going on with the salt and pepper. So you would just go for a lighter grayscale in color so that as it heals, it will fade to a nice natural gray instead of going more to the darker brown or black side. It stays in that nice subtle gray. And then as far as keeping your hair, we wouldn't go right up to that hairline. You'd stick about an inch back so that we have wiggle room for potential future loss. Now I've known you for a while and your hair hasn't really receded too much in that time, so I would feel fairly confident in going to about an inch back from your hairline, but it would just add in almost if you were using a hair powder like a Topics or a root touch-up spray or something in there, it would just make it look like that on an everyday thing, so you're not worrying about adding powders in there.
And then if I did eventually want to shave it, could we transition?
Of course. So I always look at every appointment, man, woman, whatever stage of hair loss you're in, as what is this going to look like if they shave their head on me? Even if you have a full head of hair and I'm just doing a little scar, what will this look like in 10 years? And what is this going to look like if they shave their head? So on someone with density, so at the back for Dom, he had a circle, kind of that typical hair loss in the middle, and I feathered it out to match his natural density. So if he were to continue to lose hair, there's not this big gap of tattoo, skin, hair. It all blends in so that we're just doing little touch-ups. And the same would go for you. We would just have to have you in for another session just to blend it in.
Okay.
Awesome.
Thanks.
So if your hair looks like Kevin's, you could be ready for SMP today. If you want to, wait till you have to shave or feel comfortable shaving, that's always an option as well. So I think that we answered quite a few questions just with that example. And Amy, you had mentioned, and we have some questions about this. So if you are using Rogaine, Propecia, orally or topically, do you need to continue doing that, or do you actually want to stop doing that?
So I'm a huge supporter of using an oral finasteride, Propecia, Proscard. What that is going to do, it's going to help keep the natural hair you have and help regrow any of those miniaturizing or like hairs that are on their way out. It's going to help to strengthen them. Oral medication, you can keep doing all throughout your treatments. You do not need to stop any of that. If you were doing more of a topical, like a topical Rogaine, topical minoxidil, things like that, even hair serums, what those do is they really dilate they're a vasodilator, so they're just bringing more blood flow into the hair, which will cause the tattoo to metabolize out faster or blow out and kind of make big spots. So we want to stay off of anything topical for 5 days before and 5 days after. It'll also make your skin very, very sensitive because it's bringing more blood flow to the surface and your nerves are all kind of a little bit more activated. So staying off of it for 5 days before, 5 days after for anything topical. With anything oral you are using, you can keep using that with no interruption. Also, stopping your Rogaine for 5 days before, 5 days after is not going to impact the efficiency of it or impact how your hair is growing as a result of using Rogaine. So you won't have any mass shedding or anything like that. It's not a massive disruption in the cycle of your hair.
Good question.
Perfect. So we have a question that's just come in.
Is there a typical age to get SMP?
That's a good question. It really all depends on your hair goals and what you're willing to maintain. So if you're quite young, I'd say under 30, and you're like, I'm ready to shave my head, that's fine, I'm gonna commit to that. You just have to be prepared that you can't go back. So at that point, you are committing to shaving your head going forward forever. So if I'm lowering your hairline at 21 years old, and you decide at 35 that you're gonna grow your hair out, well, now you're going to have this kind of, you're gonna have dots and then hair, and it's gonna look very odd. So you just have to make the decision. So waiting until you're a bit older and experiencing different hair options and different things to help you could be great. But that being said, if you know what you want, you know what you want. So there's really no age per se that's like perfect to have this done.
And so with that, you know, you're saying only if you actually want to lower your hairline,
Yeah.
like it's receding
Yeah.
from the front, that, you know, you would want to commit to the shaved head look. But if you actually are having balding that's happening at the back of your head, you don't necessarily have to commit to shaving your head.
Exactly.
You can just add that density to that area.
Yeah.
So there's kind of the two different scenarios, and that's why someone would want to come in for a consult, so you can see, you know, what their hair loss type is, and you guys can create, you know, the protocol. And maybe it is wait till you're ready to shave, or maybe it is something that could be treated right away.
Something I like to do in consult too is really go over all of your options, I'm not just here to sell you on SMP and tell you this is your only option. I go through absolutely every option available to you, whether it's shampoo or hair transplant or medication. I will talk to you about every single option so that you have the best educated, you know, decision-making process, and you pick what's best for you. And sometimes it might be a combination of a few things. So it's good to just have all of that information, especially if you are younger, so that you're making the most informed choice for you.
Absolutely. And part of why we're here today filming is to be able to better show you guys what the process is, what it actually looks like. So this is just treatment 1. Dom is actually going to be back for 4 treatments, so we're excited to show you guys the progression. And so you really can make a great educated decision. And we have another question, and it is, how long will SMP last? Like, what's this going to look like 10, 15 years down the road? Do I have to come back?
Awesome. So unlike the other cosmetic services we do, like brows, lips, liner, where the pigment we use is designed to metabolize out after a period of time, so you can kind of change up your look, or if you don't want to have it anymore, you don't have to worry about it. With this, I am using a permanent ink, so it will be there forever. That being said, it will fade to a certain degree depending on lifestyle. So my clients who are athletes, swimmers, avid golfers, sun worshipers, things like that, that are going to be having a lot of direct exposure on their head to sun and different chemicals, sweat, things like that, they're coming back kind of every 3 to 5 years for a touch-up, almost like a color boost, because just the sharpness of the color is going to start to fade. Just like any tattoo, the lines kind of start to get a little blurred, so we want to just keep that sharpness looking as natural as possible all the time. Also, like I said before, hair loss is progressive, so maybe you're someone like Dom who is like rocking the shape look, and as life goes on, this back part has kind of receded out a little bit more, this is receded out a little bit more, and it just needs a couple touch-ups in here or here where we've started to do the blend, but it is kind of looking patchy over time. We can fill that all in. So I'd say you can get a good like 5 years without coming in for any maintenance, which when you're talking a cosmetic procedure, that's pretty good in terms of maintenance and time for yourself.
Absolutely. So is there anybody that SMP is not good for?
I'd say if you have like an active eczema, psoriasis, things like that on the head that is not under control yet, take a minute. go see your dermatologist, your GP, and get any sort of folliculitis or eczema on the head sorted. Also, if you want to have your hair, this is mainly for men, but some women too. If you are wanting to have your hair long still, but you're wanting to lower your hairline, it won't be for you. At that point, you're looking at a transplant to add hair there. Or at the back, you're really, really wanting, that hair feel to run your hands through your hair. SMP may not be for you. It's a great option if you are looking to add density, but I can't 3D print hair on your head. So it's not going to give you the actual feel. So it all kind of depends on your level of expectation and what you're wanting out of the tattoo.
And can you tell us a little bit more about how you actually pick the color? So we can tell, Dom has darker hair and features. Kevin, like you mentioned, had more salt and pepper. What if I'm blonde?
Yeah. So there's a big misconception out there that people with gray hair or blonde hair, lighter shades cannot have SMP. And I'm here to tell you that I will challenge that. Essentially, what I do is I work on a grayscale. So I take a dark brown or a black pigment and I dilute it down to the individual person. So at the shaved head level, the hair shaft looks gray on anyone. Doesn't matter your skin tone or your hair color, it all kind of looks gray at that skin surface level. So we stick on a gray scale and then I modify it. So over the course of our treatments, I will use several different tones of that to match the natural tones of the hair and give it lots of different dimension and texture. But with the color, if I was to do you per se, Haley, I would do a brown and dilute it down to get a really soft, nice light brown. And then add in a couple dark areas, but really keep it nice and light and soft. So as it fades and heals, it's gonna fade to a nice soft gray brown and not a darker brown. So I take into account your natural features, what undertones in your skin are coming out, if you're going to pull more cool tones or warm tones out of the skin, and accommodate that.
Awesome. So we did have another question that, what if you have a husband or a partner who, they have a receding hairline, maybe it is just a patch at the back. They don't see it maybe as much as you do, and that, further down the road they're going to wish that they did something about this. So do you have any suggestions of how you can actually talk to somebody about their hair loss?
Hair loss is such a delicate topic, especially with men, because women are very aware. We have been kind of conditioned to be very aware of services available to us. And we talk with our friend groups about, where do you get your Botox and who did your nails and all this stuff. Whereas men don't really talk in groups like that about those kind of more taboo topics. So if your partner is experiencing hair loss and you're like, hey, maybe you could do something, you could always share this video. You could point out like somebody with a shaved head and be like, oh look, like you look so handsome with a shaved head. Like I think you've got a great head. I think you look great with a shaved head. Just bring up little options for them. Or honesty is the best policy. So just sitting them down and saying, hey, listen, like I want to know, like, is this affecting you? Because it could be affecting their mental health and self-esteem. And although it may suck to bring it up and point out a flaw of theirs to their face initially, they might feel really loved and comforted that you care to help them feel their best. And also if you come prepared with some options in your toolkit of, hey, this is what we could do. I think this will really help you. Just always go at it with love and compassion, because it can be a very heart-wrenching topic. Men are kind of conditioned to not have a lot of to not really care about their appearance, but deep down inside, everybody wants to look and feel good. So,
Dom, you shared earlier, you know, when you first started experiencing hair loss, maybe felt a little bit of embarrassment. You're here today for the end goal of what?
I guess like a little bit more confidence. And not have to like resort to wearing a hat all the time.
Absolutely. There's probably a lot of you guys out there who know that and have a whole hat collection because you are feeling a way about your hair loss. So this is a great option. And so we've gone through most of our questions for you, Amy, which is awesome. One of our last one is just how many appointments are we actually going to need? And also, can you have a shower? When can you wash your hair or work out or go swimming after these treatments?
so the number of appointments kind of depends on your head and how much hair loss you have. It's anywhere between 3 and 4 appointments. And then I always want to see you back for a touch-up around 6 to 12 months after our last session, just to make sure everything healed up great over the changing seasons. Especially in Calgary, we have such diverse weather, so there's lots going on. Maybe you've traveled, you know, maybe you're, especially with density, like if you've grown your hair out or up or down, like you've straightened it, styled it differently, colored it, just to make sure everything is blending in perfectly and seamlessly, and that there's no areas as you've lived in it that you want touched up. I just want to make it as flawless as possible for you. I always kind of say this is the tattoo that nobody should know you have. Unless you choose to share that you have it, nobody should really be able to tell. In terms of aftercare, I recommend you wash your hair 24 hours after, so John will be fine to wash his head tomorrow morning. Use a nice, light, gentle shampoo, nothing with too much fragrance on it. No swimming, submerging your head in hot tubs or swimming pools for 2 weeks, just like any other tattoo. You want to avoid that risk of bacteria getting in there. And then working out is a big question I get a lot. So you want to avoid excessive sweat on the area and like blood flow to the area for about 7 days, just so that it heals up really nicely and you're not at risk of kind of having what we call blowouts of the pigment expanding in the skin. So I always say, you know, don't go run a marathon on me the next day, but you can definitely light weights, light cardio, walks, things like that, totally fine. If you're in, like, avoid saunas, hot yoga, steam rooms, things like that for 2 weeks, but you're pretty much good to resume life as normal. Some people are a little bit red afterwards. I usually say don't make dinner plans, but at the same time, if you bring a clean hat or if you've got enough hair that you're putting up in a ponytail, most people are none the wiser that you've had anything done.
So that's a lot less invasive and less downtime compared to things like a hair transplant,
Yeah.
which is really nice benefit. So I'd love to just get a real close-up look of, you know, what this is looking like, and of course, being that you're doing it live, there's redness. This is all gonna fade and heal.
Yeah, so I'll kind of clean it up here, but essentially all those little dots you see are the pigment. So this is Dom's natural hair here, and then everything around it is actually tattoo. So I'm trying to make it the same size. Some people have very thick, coarse hair, so I would use maybe a different needle configuration or more pressure or something like that. But this is kind of the look we're going for, is to seamlessly blend so that you cannot tell what is hair and what is tattoo.
Awesome. And speaking of just the size of like someone's natural hair follicle and stuff, let's get a close-up of how small this needle actually is.
So this is just super, super tiny. Now it's going in and out a bajillion times here. But when I go in and make an impression, it's just going to be very, very soft and tiny. And then when I wipe it away, oh geez, there we go. You don't even really like see it. Sometimes with my density clients, after their first treatment, they're like, I can't even see anything. I'm like, well, that's the point. You don't really want to be able to see anything. And especially after that redness goes down, that color kind of pops out a little bit more, but I don't want you to see big polka dots on your head. That is not the goal.
Awesome. Well, thank you so much, Amy, for sharing with us. Of course, Dom, thank you,
Dom,
for allowing us to share this treatment with everybody. So if you know anybody who might benefit from this treatment, if you yourself have thinning or balding, definitely you want to reach out to Amy, get a consult. They're complimentary. You can initiate by calling, DMing, going onto the website. You'll have a great chat with Amy about what your goals are and what the results could mean to you. So please reach out, and thanks again for joining. Bye.
Good job, Amy.
Yes. So now, what do we click?
Oh my god, this thing got so heavy.
Yeah.
Imagine holding something like 3 times outside.
Yeah, no way.
All